Hello friends, Namaste and welcome back to my channel. In this video lesson, we shall examine what role homeopathy can play in serious cardiac cases. Here we shall be looking at one life-threatening situation. First, a disclaimer. The information on this channel is for educational purposes only and does not constitute a professional medical advice, diagnosis or treatment. Always consult a qualified health provider regarding a medical condition. The question that comes to mind is, does homeopathy have a role in cardiology, in emergency medicine, or for that matter, in intensive care? Because the general impression that people carry in their mind is that homeopathy is best suited for coughs and colds, maybe for aches and pains, and that it's a slow acting treatment for some chronic ailments, and that it is best to leave homeopathy out of emergencies and intensive care. In this video, we shall study a case from the case files of a renowned clinician from Vienna, Austria. This case was a 30-year-old case when it was first published in the book called Homeopathy in Intensive Care and Emergency Medicine. The English translation of this book was published in the year 2017. This is a 568-page reference book, and it explores the integration of homeopathic treatment into conventional acute care, emergency protocols, and intensive care settings. The case described is case number 3-2-1 and is one of acute myocardial infarction requiring resuscitation. So we are talking about a serious life-threatening case that was resolved and handled homeopathically. The person that you can see on the screen is Professor Gerhard Resch of Vienna, Austria. He turned 80 in 2017. And the case is of particular significance because in his own words, before this incident, I did not believe that a homeopathic remedy could be so successful in a life-threatening situation. So let us see what is so remarkable about this case. Briefly, the case history is that a 58-year-old male patient who had already suffered 3 severe heart attacks with burning pain suffered yet another acute cardiac arrest in the night. In other words, the heart had actually stopped. So the patient was resuscitated and his heart began beating again. He gained consciousness and spoke a few words over the period of 20 to 30 seconds before losing consciousness again and suffering another cardiac arrest. This happened repeatedly for 10 times in all. The patient presented with the following symptoms. He was reporting a burning pain in his chest, just near his or behind his sternum, just like he had in the previous heart attacks. And he kept saying that he knows that his chances of survival are low. And yet, despite his state, he showed tremendous sympathy for the doctor who had to work so hard around midnight, which is quite unusual for a person so close to death. The patient has icy cold sweat, which is quite remarkable, and his skin is waxy and ice cold with blue and white marbling, a clear sign of cyanosis. And yet, despite being so cold, he does not want to be covered, which is quite a contrary symptom. Now, an ECG was taken between those cardiac arrest episodes, and what the doctors could see was clearly an ST elevation, which was easily recognizable. In the next slide, we shall see what is the significance of an ST segment elevation. What you are seeing on the screen is the trace of a normal sinus rhythm on an ECG. We have a P wave, which is followed by a narrow normal QRS complex, and that is followed by a state of electrical quiet that is known as the ST segment. And this is a flat line of zero voltage, an electrical quiet, also called as the flat isoelectric line. However, in an abnormal ECG, this could be displaced upwards or it could be displaced downwards. What is shown on the screen is the case where the ST segment has been displaced upwards. We shall now see what it means in the next slide. An ST segment elevation can normally be seen in the V2 and V3 leads. And in the case of males who are over 40 years of age, it is considered elevated if it is more than 2 millimeters above the isoelectric line. It indicates ischemia or an infarction, and that too a transmural one, which means the damage is to the full thickness of the heart muscle. But it may also be due to some other reasons, such as a left ventricular hypertrophy or due to a left bundle branch block. But for the time being, we are not concerned with the other things. Now, the practice of homeopathy is both a science as well as an art. Roger Morrison, an allopath by education and training, who turned to the practice of homeopathy, reminds us in his famous book, The Desktop Companion to Physical Pathology, that in classical homeopathic literature, there is no differentiation between angina and myocardial infarction. Also, there is no guidance in terms of ECG findings. But that does not mean that we can't apply homeopathy in such cases. So what did Dr. Resch do? What he did was he used the standard practice of using generalities and modalities, something which was introduced and stressed upon by Dr. Bonninghausen more than 200 years ago, because they represent the whole patient. Many people, for instance, may experience the same local symptoms, but the way the entire organism reacts to that is what differentiates one person from another. This is a unique concept of homeopathic analysis, because in homeopathy we believe in individualizing the treatment. This concept can be best understood by looking at the strategy of Dr. Resch. Here are the symptoms taken by him. The numbers in the brackets shown at the end indicate the number of remedies that are covered in each rubric of symptoms. So the first one is that the patient has reported pain just behind his sternum, which is of a burning nature. Also, warm air aggravates. That's why he does not want to be covered, even though his body is very cold. The third one, of course, is that the skin is very cold externally. The fourth symptom is the cold sweat, which is quite characteristic. The fifth symptom is the cyanosis, the blue marbling effect on his skin. And the sixth symptom that is taken is the very sympathetic, empathetic nature of the person, where even though he is in such a precarious condition, he has got that empathy and compassion for the doctor who is attending to him. This is indeed quite a rare and particular symptom for a person so close to death. Now here is the analysis which you can see on the screen using the Radar Opus software. But back in 1977, Dr. Resch did not have access to such advanced tools. He had to in fact use the printed version of the repertory book and a paper and a pencil to make his own chart. As we can see, The leading remedies are carbo-veg, phosphorus, and arsenicum. Out of these, carbo-veg and phosphorus cover all the 6 rubrics. Arsenicum album comes a close third, but we can eliminate that because the patient was quite composed despite his serious condition. A patient requiring arsenicum album is very restless and fearful, which this particular patient was not. In the previous analysis, we have done a sum of symptoms analysis. If we do that by considering prominence, where the higher grade symptoms are given greater weightage, we also still get nearly the same results. So we can zero in and say that carbo-veg and phosphorus would be ideally suited. But given the fact that carbo-veg has got a higher score in both these analyses, the doctor decided to choose carbo-vegetabilis. As per the analysis, Dr. Resch selected carbo-vegetabilis 30C potency, and he gave one single dose of 3 globules. I feel it is best to quote the words of the doctor himself, and he says that before carbo-veg is administered, the patient's pupils dilate, his breathing ceases, and his heart stops beating. Now they have decided that heart massage is to begin after the remedy is given. So let us see what happens after the remedy is given. Now continuing in the doctor's words, immediately after the remedy is given, 2 small red spots appear on the patient's cheeks and they feel warm to the touch. His body begins to return to life and the heart massage is suspended for the time being. The patient begins to breathe deeply by himself. The heart starts beating on its own accord. The body becomes warm, the cold sweat disappears, and all the vital functions return. Then the angina-type pain which the patient had experienced disappears and he wants to sleep. He has no more symptoms during the 8 days for which he remains in the hospital for observation. And no conventional medication is required. Mark the words, no conventional medication is required. 2 years later, he has no recurrences. He is free from all the symptoms that had brought him to the hospital in the first place. And finally, it's a happy ending. He feels well. Now, carbo-vegetabilis is also known as a corpse reviver. It brings the dead back to life. And here are the words of Dr. George Vitulkas, a very famous teacher of homeopathy of world renown. He says that it is interesting that this remedy has a reputation as a corpse reviver. People who are almost dead, almost lifeless, come back to life with surprising ease under this remedy. It will prevent severe complications or even death in certain cases. At least this is the feeling that you have when watching such cases. And I think he's not far from truth. 30 years later, looking back at the case, what does Dr. Gerhard Resch have to say about it? In today's modern world, he says, from a modern point of view, a heart catheter examination would have been performed, and as per present guidelines, an implantable cardioverter defibrillator or an ICD would have been installed. Few would even dream of homeopathy. And I don't think he's too far away from truth. But this was a great lesson for us to understand the role that homeopathy can play, not just in coughs and colds and aches and pains, but in serious conditions where people are admitted to intensive care or in emergency wards or in cardiology cases. So friends, that brings me to the end of this video. Thank you very much for your attention and for the time that you have given. I will now just summarize the three main points that we made in this lesson today. First, homeopathy works in acute episodes, emergencies, as well as in intensive care. The second important point is that in our analysis, in order to select a remedy, the generalities and modalities matter more than local particular symptoms. This was a beautiful case where this fact was brought forward. And thirdly, homeopathy can both be an adjuvant as well as the principal treatment. So that is all I have to say today. Thank you and meet you in the next video soon.